Yes, sir.
So when you said like developing habits in like health education is a big part of your job.
Huge.
So when you get patients who come in and they have some sort of injury due to, you know, a habitual like posture
Chronic
issue,
thing,
let's say, yeah, something like that, or like they're just unhealthy due to something they do in their routine. And then you educate them, and then they come back later with the same issue because they just ignored your advice. How do you deal with that professionally? Like without just like making them feel like, I've already told you this, why aren't you doing it?
Nope, I go, hey, let's start from the beginning. I know you had a rough time. You may not have stuck right away. Let's start over. I give them gratitude as much as possible. I'm grateful for them to come back to my office, and I give them as much leeway as they need. Because everyone's life is different. You may be them for 5 minutes. He might tell you that they lost someone last week. They've had a rough time at home. They lost their job. So their life is going to change, but not around you as a doctor. So I'm going to go, you're here a year later. Yes, we talked about that stuff. Let's see where you are now. Let's start over. They go, thank you. Because they might not have been a year ago ready to hear it. They may have been immature. Their life might have been easy back then. But now they're ready. It's about timing. Can you be there when they need you for their injury at that moment, for that day, for that time, for that year? You can't make it about it. So you got to go. When I'm here, I saw you last year, Jerry. At that point, we talked about this. You weren't able to do that. Let's start over again. Let's find out what's going on today. Now they're here. When they come back again, now they're willing to listen. Now they want to hear you. They've not been ready a year ago. I put stuff on social media every day, and I'm there because I want people to hear me when they're ready. To make that phone call because they saw that video last week. So you have to be sure you're ready when they're ready, not because you're there. But good though, a lot of people don't understand that. I have patients, a lot of senior patients, they come to my office and they're upset because they go to their doctor, and the doctor goes, well, I told you to take the medication, but doc didn't work. I said physical therapy, but doc didn't work. They get mad patients because it's not helping them, even though they're not listening to the patient how they want to be helped. So you have to be able to, like you said before, be there when they're there. That's when the timing is about them, not about you. Good question.